The head of the FDA could approve Pfizer's COVID-19 vaccine today. The White House is reportedly pressuring FDA Commissioner Stephen Hahn to grant an emergency use authorization or face possible firing. Earlier today, Hahn said the agency is rapidly working toward finalization. Less than 24 hours ago, an FDA panel voted overwhelmingly to recommend emergency use of the vaccine. And looking ahead now, the CDC is expected to vote this Sunday on who should get priority shots. The first 6.4 million doses of the vaccine will be given out to states, and that will be based on population. Now, we're told those vaccines will be arriving to our local hospitals in the upcoming week. On your side's Brianna Ray Turner joins us live from Baptist Health about the next step for the shot. And everybody's wondering when will they come?
Yeah, well, doctors at Baptist Health are very excited for this vaccine. Now, one doctor tells me this is going to be an intense process.
We certainly don't want to risk wasting any of the doses, and we want to make sure that we use every last dose that's possible.
Baptist Health has identified their first group of high-risk healthcare workers that will be getting the vaccine. The next step, waiting for the allocation from the University of Florida.
Ahead of time, we will be working with our team members to get them signed up, getting an appointment scheduled at the same time that the first injection is scheduled.
The healthcare workers will also plan for their second injection, which is exactly 3 weeks later.
Once the University of Florida folks bring over the vaccine, we have capabilities for managing the process of handling the vaccine, the supplies, keeping it cold and refrigerated.
Baptist Health will be having a practice round ahead of time, so the process will run smoothly.
Now, coming up at 6, I'll tell you how patients are reacting to this vaccine. I'm live in Jacksonville. Brianna Ray Turner, First Coast News, on your side.